Hi, everyone. Welcome back to Walk with Me. I'm your host, Amr Hosseini. I'm grateful to have Nikki with us today. Nikki, welcome. It's great to have you here.
Thank you so much. It's great to be here.
Let's start, Nikki. Before to dive in, if someone meet you for the first and ask, who is Nikki? How would you introduce yourself?
I'm a clinical psychology researcher at UC Davis Health, and I have a bachelor's of science in psychological and brain sciences and a minor in applied psychology and Iranian studies. And I work in clinical psych research. I am very passionate about digital mental health and mentorship in the Iranian community. So it's a little bit about me.
Right. Thank you so much. What first sparked interest in psychology? Was there a moment that shaped your path?
My interest in psychology started from me first wanting to go into medicine and being pre-med when I joined UCSB as a freshman in 2019. And I went in as a bio major and I always wanted to be a physician. But then as I took some classes, I realized that both the time commitment and the kind of lack of work-life balance that I saw myself going down if I wanted to continue with medicine didn't really match the lifestyle that I wanted, and I felt like it wouldn't have been as healthy and balanced for me. So I chose to take a step back for a little bit, and that was also during the same time as COVID. I know a lot of people had some kind of mental health challenges, especially students were experiencing a lot of burnout at the time. So I was in therapy at the same time too, and I realized that I really like the kind of flexibility that my therapist has. And she's actually Iranian American as well, and a woman. So I really enjoyed the flexibility she had, both with her schedule and being able to do her work through telehealth on Zoom. And I realized that I still have such a respect for science and STEM and research. And I also love helping people feel better and especially preventing people from getting to the point where they are, needing support. And so I realized that psychology is really a wonderful avenue to do that.
Right. Thank you for sharing that. Really inspiring. Can you share more about the app you're working on at UC Davis Health for clinics? What does it do and what impact are you hoping for?
So, I work for the Early Psychosis Intervention in California program, or EpiCal for short. So, early psychosis is the early stages of schizophrenia. This usually starts to impact people around the ages of 13 to 30 years old, but most specifically between like 21 to 27 is when people first start to see the onset of schizophrenia. And so, there are these early psychosis clinics across California. Some of them are county clinics, some of them are university sites like UCLA, UC San Diego, Stanford. And so all of these schizophrenia clinics, early psychosis intervention clinics, we're bringing them under one hub with the EpiCal program and allowing them to learn from each other and learn their insights through this learning healthcare network where we allow clinicians and researchers to get together and share their experiences being service providers and what has worked and doesn't work. And then another really awesome thing that we have is the app, which is Beehive. It is allows people to see their progress through their treatment through surveys
Right.
that are conducted every 6 months. And these surveys ask questions about anything from people's social relationships, life outlook, and also traditional mental health symptoms and diagnoses like schizophrenia and anxiety, depression. And so these surveys are administered every few months, and the service user, their support person, and their clinicians can respond to these surveys, and they can see on the app different graphs to see their progress over time. The app also gives the clinician a urgent clinical issue notification if the service user endorses that they might be thinking about hurting themselves or somebody else, or if they may be facing a housing insecurity like homelessness. And so it's a wonderful tool to really allow people to use their data in care. And that's really our hope for it, is for people to have more control of their data in care.
Right. That's really innovative. Have you tried the first step, like the MVP for this app?
Yeah, this app has been used over the span of now about 5 years across 29 different clinics, and we have had thousands of service users successfully using this app in their care, and we've received a lot of feedback that this has been really beneficial to them.
What was your experience like as a vice president of UCSB Persian Student Group? What did you take away from the role?
I was the vice president of PSG at UCSB in 2022 to 2023, which was a difficult time for the Iranian community. There were some political activities going on both in Iran and the United States. And so it was a little bit tough for people to navigate those situations, especially as a leader of the largest Iranian or the largest cultural club on campus with 200 active members. There was a lot of eyes on us to be leaders and to create a safe space where people could come together for networking and community building and feel like their differences and opinions could be set aside to really come together to celebrate the culture and create a community for each other. So the biggest takeaway that I had from that experience is the impact that community building has in people's mental health, in their careers, and also the leading aspect of it was so wonderful. I organized a huge Nowruz show that we had, a 3 hour long show with 500 attendees and a several $1,000 budget. And it took months to organize it. But really, what I took away from that experience was how important collaboration is and how absolutely valuable it is to work together and how nothing can be done alone. And so I think the mark of a truly good leader is how well they can bring people together and motivate them to use their own capabilities to the best that they can.
Right, that's a great example of leadership. I'm interested to know about, I think you have an app we call Tuloo Health. What inspired you to start Tuloo Health? How did that journey begin?
So actually, I thought of the idea for Tuloo in a public speaking class I took at UCSB, where we were asked to create a startup pitch as our final project. And I thought of the word Tuloo because in Farsi and Arabic, that means sunrise. And a lot of times for people dealing with a mental health challenge and difficult time, receiving services can really be the beginning of a very new chapter in their life that's free of suffering. So the concept I had for Tuloo originally was going to be an app-based provider of mental health services, both in community settings through group therapy platforms, as well as one-on-one therapy, resources and journaling and classes on the app itself. I'm still in the process of research and development for that application, but I eventually also pivoted it to be kind of the name and the face of what I now have as both a content creation platform and as a life coaching system that I'm working on right now and that I'm actually implementing at the moment. I wanted Tuloo to be a space where I can share my experiences through being a psychology student and the career aspects of it, as well as the things I've learned and the insights I've gained about mental health and wellness, and just be a platform for motivation for young people from the content creation side. And from the life coaching side, I provide one-on-one life coaching to young people from the ages of 13 to 21.
Thank you so much. Before to move to another question, what gap did you see in the mental health space that Tolo is trying to fill?
First of all, for the content creation aspect of it, there's a lot of information online about mental health and well-being. Millions of people every day Google mental health topics. One niche I realized was missing was information about how to enter this field. And a lot of times I tell people what I do, and they are very confused. And they're like, what is a clinical psychology researcher? What does that mean? So I think there's a lot of misinformation, lack of information about how to break into the field of psychology. That was a huge part of what I wanted to achieve through this content creation. And then another part of it was really motivation, all of the little bits and pieces of knowledge that I've gained over the years in my own experiences to help people have a more positive and motivated lens to life.
You mentioned early about content coaching. What is the difference between life coaching and traditional therapy, such as talk therapy?
Talk therapy and traditional like cognitive behavioral therapy, things like that, they are very much through a rigid diagnostic lens that's guided by the Diagnostic Statistical Manual, that is this big fat book that psychologists use with a bunch of different psychiatric diagnoses in it to bill insurance, essentially. That's what it now is used for, even though it was not created and intended to be used for that. So a lot of times, both service providers, like the clinicians themselves, and service users find themselves in this very narrow space, trying to fit all of their needs and concerns into the 30 minutes of therapy that they have every week, or 50 minutes sometimes, and trying to summarize all of it into a very cookie cutter diagnosis. And Another issue aside from just the platform not being rigid and not a lot of times being what people need is that traditional therapy nowadays and clinicians are moving away from using insurance, and a lot of them don't accept insurance. So this has become a burden onto the service users, and a lot of them aren't able to access mental health care anymore because they're unable to pay for it. Frankly. So, life coaching is unique where it's not so much through the diagnostic and psychiatric lens, it's more holistic, health science, positive psychology, and allowing people to really tailor what they need in their sessions. Somebody might need help with organizing their health and their wellness, with navigating a difficult social situation or a life transition, changing their habits and their lifestyle. And they might best be able to achieve that through organized plan that I build for them, or through regular messaging on a weekly basis, or through even like an outdoor activity or introducing them to someone. And it might not fit so neatly into a 50-minute therapy session. I think life coaching is unique where it's more of a peer support based and organic, tailored experience.
That makes a lot of sense. In your experience, which one tends to leave a bigger mark on someone?
I think they both have their distinct places. I do not think one can replace the other. I hope to eventually become a clinical psychologist myself and definitely be on the more traditional side of psychiatric care. But I think that life coaching is more for somebody who wants to make a change in their life, who wants to navigate a transition. Therapy is more for someone who is really experiencing an acute psychiatric distress. And so those two things cannot be replaced, and they both have their own unique benefits and supports.
Thank you so much. How do you see our generation's relationship with mental health evolving, especially in regards to the use of digital tools and intervention in mental health?
That's actually exactly what I'm really passionate about. I am very interested in digital mental health. And when I say that, a lot of times people are like, what does that mean? In summary, it's the use of technology in mental health. That is the most simple way of saying it. But this takes on a couple different forms. It could be through wearable tech, like an Apple Watch or a Whoop band or a Ring, where it takes what we call ecological momentary assessments, where as you're living, it takes your blood pressure and your heart rate and your HRV to give you insights about anything from your sleep to your anxiety to depression. That is one aspect of it, is wearable tech. Another aspect of it is therapy platform applications like Two Chairs or Grow Therapy that either create a platform for clinicians to be able to provide one-on-one talk therapy via telehealth. And they kind of take care of a lot of the difficult overheads to keep clinicians from being able to establish a private practice, like dealing with insurance and dealing with legal liability and setting up appointments and
Interesting.
finding patients. Yeah. And so there's a lot of different, and then there's also apps that help people through like everyday practices that we call single session interventions. And they give you a like journaling prompt, or they have you watch a video and answer some questions that help you reframe your way of thinking about an issue that's causing distress for you. And all of these are very well researched at big name academic universities, anywhere from Harvard, Stanford, Northwestern, where they're really doing cutting edge research on how we can use these tools to best serve a broader audience. And the biggest point that I want to make about this too is a lot of times people are skeptical about these interventions, and their number one concern is how does this stack up against traditional therapy? I think the digital mental health community always has a response to this. The purpose of these tools is not to replace traditional therapy, but it's to fill service gaps that otherwise would be left unattended to. And this could be anyone who can't access care for anything from not being in a good geographical location to access care, like they're in a rural environment, or somebody experiencing high levels of stigma in their community and not being able to ask and reach out for help, to financial burden where they're unable to cover the cost of therapy and services. So it's really meant to provide service to those who otherwise would not receive care, not to replace traditional therapy.
Like, is it domestic or no international?
It's definitely international. This is something that is happening across the world.
Right, that makes a lot of sense. Nikki, I feel like our generation is finally starting to talk more openly about mental health, especially online. How do you see this evolving, particularly with digital tools and interventions?
People are starting to ask the right questions and they're starting to think a little bit more critically about their mental health, especially in their families and the experiences that they've had growing up and things like that. But with that, it also brings up a new issue where there's a lot of pop psychology. People are throwing around a lot of big psychiatric and psychological terms and conditions every time they see some sort of micro behavior in their day-to-day life. That's not great because a lot of times that confuses the narrative. Sometimes it can create new stigma around certain topics and certain diagnoses. And so it's good that we have more availability of information. That's wonderful. But I think it's also important for people like me on the research and the clinical side to get ahead of that and make sure that the information that's out there is as accurate and useful and helpful as possible. But it's wonderful that people are talking about it more. That really is.
What unique mental health need and challenges do you see in immigrant communities, especially amongst Iranian Americans?
I think the most glaringly obvious issue in immigrant communities with mental health is stigmatization. A lot of immigrant communities have high levels of stigma around any kind of discussion regarding mental health. And a lot of times people are afraid of receiving care too because they're afraid of being labeled as having a specific kind of an issue or being a specific kind of person. I think that in the Iranian community too, the unique challenge is Iranians have a very large interest in being very positive, and they a lot of times try to mask issues that they can be experiencing individually or within their families and kind of sweep it under the rug. A lot of times Iranians say bozorg mishi yadet mire, which means
Yeah.
you'll grow up and you'll get over it or you'll forget about it. But unfortunately, that's not how it works. And until we can get to a place where we're able to really name what the issues are and admit that we do need to receive traditional support for them in some methods, which again, digital mental health could be a wonderful way of circumventing some of that stigmatization, but at least receiving some sort of care. That is really the only way that we're going to be able to break down some of these generational issues that continue to plague our communities. So it's really, I think stigma is the largest impetus to people receiving care and changing the narrative of their generational traumas.
Right, I totally see that, but I wonder, do you think there is still a hesitation in Iranian families to actually seek help even when resources exist?
Yes, yes. And again, I think the issue is that there is this idea of normal versus abnormal. I think we have to come to a place where we realize that it is normal to experience acute psychological distress. It is normal for people to have differences in the way that they cognitively view the world and in the way that they process emotions and experiences. There's no one size fits all. And so when we can come to that point where we admit that there is a large spectrum of differences in people's thinking and experiences, I think that's when we're able to actually reach out and access the resources that exist. It's wonderful to see that there's so many mental health providers that are now Iranian coming up in around the world, but especially here in California. But in order to access those, we really need to be able to admit to ourselves that it's okay and normal to receive care.
For what I understand, you are passionate about mentorship and supporting Iranian women in STEAM. What advice would you offer to young women navigating that path?
The number one advice that I would offer to them is
Yes.
to really think for themselves what kind of lifestyle they want to have outside of their ideas of what the expectations of their communities are. I think a lot of times, especially in the Iranian community, there are a lot of opinions that people have about what kind of disciplines or lines of work is appropriate for a woman to have. And, we have some wonderful examples, such as the astronauts that we're seeing popping up right now that are Iranian and they have children and they're women. Any field can be appropriate for anyone as long as it really fits their lifestyle and their priorities. So the advice I have is to sit and really think, what kind of life do you want to have as far as the time commitment and financial burden to receive the education that requires that job? What is going to be the setting of the work that you're going to have, your career? What is the financial prospects of the compensation you're going to receive? What is the work-life balance you can have? And then make that decision for yourself. And however you choose to move forward with your career is completely fine, but make sure that that is fitting your priorities and your expectations for yourself, not what you perceive your community as wanting for you.
Right. I really appreciate you sharing that. It's powerful advice. Let's talk about your vision for the future. How do you hope to expand your impact in STEAM, especially for other Iranian students who are just starting out like you once were?
Yeah, I think my biggest hope is that I can give them the insights that I gained throughout this process to be where I am today, which I still have such a long way to go, but just that I've had the, privilege of being able to work as a research assistant for Harvard for 2 years and publish with them, or to have a full-time remote job working on things that I absolutely love. I think the key to that is to not gatekeep it. I never have this idea that if somebody else learns what I did, it's somehow going to take away from me. I always think the more I can give back to people, the more it's going to come back to my community and it will build us up as a group. And so I always want to try to share my experiences, which is a huge reason that I started Tuloo, and the content creation aspect of it is so I can really help people know how to navigate this different fields in STEM.
What are some particular ways you protect your mental health in today's face-paced digital world?
It's important to know when to turn off the screen and turn to your community. I think I've mentioned the word community a lot of times here because I think that
Yeah.
is truly so valuable. And that's something that, a lot of times we get really caught up in doom scrolling and we'll, get on TikTok or Instagram or something and we'll just keep scrolling for hours and we won't know where the time went and we'll be left feeling hopeless and overwhelmed by all of the information that we're receiving. Because I'm going to go back to psychology here. Every one of those videos, those posts that we're seeing is creating a new feeling in
Right.
us. And that constant 5 second, sometimes 1 second shift in emotions is really not good for you. So I think limiting your screen time, knowing when to turn off the screen and go into the community, spend time with your friends and family and loved ones, and also even having some time that's completely separate from socializing online or offline. I every day go for at least a 30-minute to 1 hour walk in nature without headphones, and I just listen to the world and allow that to be some isolated time outside of the craziness of today.
Yeah, I love that. It's a great takeaway for all of us. So, Nikki, before to move for the last question, if you weren't in STEAM or mental health, what do you
Uh-huh.
think you would be doing instead that?
I think that I would definitely go into business and I would be on, and that's kind of my second passion.
What
And I
business?
would, yeah, I would still be interested in health tech. I would just be on the business side of health tech and more of on the kind of operations and management and funding and things like that. Yeah.
The last question, Nikki, what is day-to-day life on an academic research? Like, how can undergrad student without much experience get involved in research?
The day-to-day life of an academic researcher is to usually analyze data and support with whatever stage of research that they're in. So if they're still in the stage of literature review, you might have to go through Google Scholar and look at, or PubMed, and look up some articles, research articles regarding that topic and help build the kind of academic framework for the topic that and the hypothesis that they're presenting. If they're on the data collection side, you might be helping run participants through the study, whether that's filling out surveys or taking blood samples or MRI scans or something like that. If you're on the data analyzing part of the study. Then you are on Excel and RStudio and Python, analyzing the data, using code and computer science to run statistical analysis to draw conclusions about the findings. Then if you're on the publication and presentation side, you might be writing up the final manuscript, so putting up all the pieces of the research together to write like a nice paper about it, or you might be putting together a poster for a conference presentation, which is essentially like a big get together of a bunch of researchers who present their research findings and learn from each other. And then how young people can get involved, especially when they don't have too much experience in research, is to just reach out to faculty at their universities who are doing studies that they're interested in. And the way you find out about that is usually every department has a faculty page with all of the faculty's labs listed. And so you go onto those pages and you read their about sections and you see what kind of information they're researching and they're trying to learn more about. And then you can reach out to them and see if there's something that you can do to build your application to be able to be qualified to do that kind of research. Or sometimes the faculty might just say that they're taking undergraduate researchers and that there's really no experience necessary. So, especially if you're in your undergrad, that's the best time to start and to build your resume up if you're interested in going into research.
Right. Thanks for your advice. Before we wrap up, two quick questions that just came to my mind. If you could go back 5 years, what's one thing you will do differently? And looking ahead, where do you see yourself 5 years from now?
If I could go back 5 years, so 5 years would be my senior year of high school, or when I'm starting my freshman year of college. I would take it easy more. I think I put a lot of academic stress on myself to be kind of as perfect as possible. And I think I've learned now that less than perfect isn't just the next best thing, it is the best thing itself. If you can do things and complete things, but do them imperfectly, that is much better than having a bunch of ideas sit on the shelf because you're too afraid to not do them perfect. And so that's my advice I'd give to myself 5 years ago. And then 5 years from now, I really hope that I'm in my like third or fourth year of my PhD, or my doctorate degree if it's a PsyD. And I hope that I'm using all of my knowledge and skills that I'm gaining in my doctorate program to just hone my skills and be the best clinician, researcher, and innovator that I possibly can.
Right. Nikki, thank you so much for joining us. It's been an inspiring conversation. Before we wrap up, is there anything else you'd like to share with our audience?
Follow Tuloo Health on Instagram and TikTok, and we're setting up appointments for one-on-one life coaching sessions on my website. That's also on Instagram in my link in my bio. So I would love to work with anyone 13 to 21 years old who's interested in making a change in their life or navigating a difficult time. And yeah,
Thank you, Nikki,
it's been
and
wonderful being
have
here.
a wonderful day.
Thank you.